It's a long time that you give us the opportunity to watch your videos, and I think now there is a big movement and they have to see all this what you have done, and I wish you that you will be bigger and bigger and bigger and more common because you've done a really great work. Thanks a lot for this. My name is Dr. Petra Bracht and I'm a physician over 30 years, work mainly with nutrition. It is my experience that most of the Western diseases can be healed by whole plant nutrition. At the beginning of my work, I was sure that the nutrition was the main aspect for healing, but during the time I worked with my husband together and we developed special pain therapy, and also we developed moving system named LNB motion. And during this working together I mentioned that it's not only one thing that it's necessary for good health, we need two things. One is a very good quality of movement, and also a good vegan plant nutrition, and with a lot of fresh vegetables and fruits. And if you have all these together, you can be healthy for the rest of your life, and even if you are already ill, you can cure with this both methods.
My name is Roland Liebscher-Bracht. I studied engineering, not health and not medicine, and I did martial arts my whole life. And doing all these different movements my whole life allowed me to develop, together with Petra, a pain therapy and a movement system, which is a basic thing for the health of every people. And since 30 years we are working on this, but since 7 years we teach people, medicines, doctors, physiotherapists, osteopaths, and natural healers in this knowledge, so that they can bring it to the people, to the patients. And our aim is that we help to change the world, for that the people have the possibility to be free of pain, to be in full movement, and to be healthy until the life is. Maybe it's 80 or 90 or 100 years, to be able to live like this. And
in the best quality they can get?
In the best quality they can get, yeah.
That's it?
That's it. Normally there are two patients who are visiting us. I start with the first, with a pain patient, and then Petra goes on with a health patient. Even pain patient is coming, I explain him that most of the pain nowadays is because of the muscles and the fascias, which are in not a good level of training. Why is that? Because nowadays we don't move like we are genetically planned. And because of this we only use maybe 10 to 20% of our possibilities to move. And that's a big mistake and genetically not planned. What is the result? The result is that your brain changes in a certain way, so that the fibers of the muscles are working not good, and then the fascias of the whole body, they begin to be shorter and tensed and all this. And because of that, the joints, your spine, there is too much pressure in it, and all the parts of the joints, they are going to be damaged. And because of this, the body brings a pain to prevent this. And then we do a certain therapy. We go on the bones, because there are little receptors, and these receptors communicate with the brain, and so we stop the pain in the brain. And the second step, we give exercises to them, special exercises out of this LNB motion, this movement system we developed. And then with the exercises and maybe 2 or 3 other therapies, the pain from the shoulder, for example, or for the hip or for the knee is gone away for the whole life if they do the exercises. Even in the moment the cartilage is away, not longer in it, bone to bone. Even when the discs are broken, it functions like that.
We find out that the pain does not come from structural destroyment. If a bone is destroyed or if the cartilage is away, this is normally not the reason why the pain is coming. The pain is coming because we have functional
the function is destroyed.
Is not okay with the muscles. And there, where the muscles are not in a functional way, the body gives the information of an alert system, and so we get pain.
Alert pain, maybe, and because of the alert pain, it's possible to reduce the pain within mostly the first treatment. Because if the pain is coming out from the structure, then it would not be possible to reduce it in the first treatment because the structure is like it is. And so it shows every time that the pain is from the muscles, from the fascias, functional pain, and so it's a proof in itself.
And it's very important to know that the treatment is only the beginning of the wave without pain. The very important thing is that the people does their exercises to make this muscle to bring the muscle in the right way.
To make this situation normal.
Yeah.
Okay. Yeah, we change it in the brain, but the structure is still not in a good way. But with the exercises, more and more, the structure is beginning to be like normal, like it's genetically planned. And then we give 1 or 2 other treatments to make it stronger, this new way for the brain and for the muscles and for the fascias, and then it's done.
And all the people can do this by themselves. So they only have to go to a therapist once, twice, or 3 times, and then they can go on by themselves. So we give them all the information what they can do to be healthy by doing these good things with themselves. And this is the best thing we can do, I think.
We let them free, because you have to understand, nowadays, worldwide, I was everywhere. Yeah, worldwide, the pain, it's a not solved problem. Yeah, where you go, it's not solved. And so we have many, many millions alone in the German-speaking countries like Germany, Austria, and Switzerland, which is about 100 million people. 40%. They are suffering with pain and they have no chance for a solution. And so it's very important that we have a therapy which is not over years and months, but short. And then the patient has to do for himself so that the other 3 patients can come. And then they go, after 2 or 3 treatments, and the next can come. Otherwise, we have no chance to give this planet a chance to be pain-free.
But therefore, we give seminar for therapists, and
the last 7 years, 4,500 doctors and physiotherapists and osteopaths, they followed our courses. Yeah. But that's only a little beginning, and we have to go in the other countries, like here in Italy. Yeah, they want to have it now because they saw the function of this system. And so we have to go to do more and more all over the world to teach the people to do this therapy and to teach also this movement system with the exercises. Because if children 6, 7 years old, when they go to school, once a week, twice a week, they do exercises like this, it's no need to get pain, no need to get arthrosis, no need to get broken discs and things like that. And in the moment we teach this, it's a very good way for the whole future of the planet. What we developed the last 30 years, the name of this pain therapy is pain therapy by Liebscher and Bracht, which are our names, and short name is L&B pain therapy. Yeah. L and B for Liebscher and Bracht, and N for and. And the name of our website for more information is www.Liebscher, which spells Liebscher minus Bracht, which spells BRACHT.com. So our pain therapy also functions with the so-called disease, fibromyalgia, because for us it's only pain, but not one pain in one body, but 7, 8, 10, 12 pains. We had therapists, doctors in our courses, they had this so-called disease, yeah? But the only reason to say this is a disease is that the normal medicine not understand much about pain. Sorry for saying like this, but it's the truth. Because in the normal medicine, they have no idea of the muscular and fascial tensions, and we know and we see every day, and 4,500 therapists from us, teach from us, they see that more than 90% of all pain on this world is because of the muscles and fascias. And it's clear, it's unbelievable normally. It's not to believe, but it's fact. And in the moment you get in touch with our therapy, you will realize that it's hard facts. We treat fibromyalgia like a normal pain. We start with the mostly pain, maybe it's the back, lower back, often it's like this. Then we treat this pain until it's away, then we go to the next. But with the fibromyalgia patients, the so-called indirectly factors like nutrition also has the reason, because nutrition also changes the tension of the muscles and of the fascias. But for this, she is the expert.
Yeah, so I treat the patient if they come with fibromyalgia, for example, and I suppose them to change their nutrition in a very good, proper vegan plant food, whole plant food. And if they do this very exactly, it's about 10 days later, they feel how the body changed, and that the pain goes away.
And in combination with
the combination with the pain therapy and with the exercises, it's the best what they can do, because it's the metabolism can go also to the part of the body where there was not enough metabolism because of the exercises. And now what the body can do, they can take on the good nutrition, they can mix it, and they can give it out. And also by giving it out, they can give out also the toxins in the body, so they make a detox. And if they do detox, exercising, and following good nutrition, that's all what they have to do for being without fibromyalgia, without having pain, and being healthy. I'm doing detoxing for sure, but I'm doing a lot of detoxing. It depends of the people, it depends what diseases they have. Normally I started with colon hydrotherapy. I do it since, 28 years now, and it's the best thing to clean the colon. And I also do fasting. I like fasting, but my new kind of fasting is smoothie fasting. It's so very easy, and it's also for the digestion. It's perfect, and people get vitamins and minerals and all this stuff they have to get to make a better detoxing, and for the metabolism it's very fine. And if they do their exercises, it's more than double. It's synergistic effects, and it's the best they can do.